Namaskar. I am Dr. Ravi Kant Singh, Maxillofacial surgeon at Shanti Mukand Hospital. I have been specially trained for cleft lip and palate surgeries. I have a fellowship from India and abroad from Switzerland. I have an experience of 15 years in treating cleft lip and palate patients and have done more than 10,000 surgeries across India in various hospitals for various organizations. And at present I am at Shanti Mukand Hospital. Let me explain you what is cleft lip and palate. In simple words, cleft lip and cleft palate is a gap in lip or palate due to lack of fusion of two halves of the face or inside of the mouth, that is the palate. It happens during the first trimester of intrauterine development of the baby. The incidence of the cleft lip and palate in India is roughly 1:700, but varies again depending upon different geographic locations and the social strata of the people. It is one of the most common congenital deformities found among various types of congenital deformities. There are various types of facial clefts. It depends, it may be a cleft of upper lip, lower lip, or the side of the lip, or at times even the cleft of the ear, cleft of the eye. And it is often associated with various other congenital deformities like cardiac deformities or the deformities of the limbs. So it's a complex of many deformities associated together with various syndromes which have to be tackled separately at different stages. Now let's try to understand why this cleft lip palate deformity happens. There are certain myths and there are certain realities or truths. Let's try to know the first. What is the most common myth spreading among the people? It is said that if a pregnant woman comes out of the house during a solar or a lunar eclipse, then the cleft of the lip happens or the cleft of the palate happens. But this is completely a myth. It is actually related to nutritional deficiency during the pregnancy or before the start of the pregnancy in the mother. And the most common nutritional deficiency is the folic acid deficiency. Usually it is advised to have a folic acid tablets before the start of pregnancy, approximately 3 to 6 months before. Other common cause is a hereditary, that is due to genes. If the deformity is present in the previous generations in the family, then there is a high probability that cleft lip palate can happen in the coming future generations also. Another common reason is the consanguineous marriage in the society, which leads to various other kind of deformities apart from facial deformities. Now, what are the problems associated with the cleft lip palate? What a child will have the problem and what the problems parents may face when a child is born with a cleft lip palate. Normally when a child is born in the home, it is celebrated, people are happy. But when a child with a cleft is born, there is no happiness at all in the family. People are shy in telling, or in fact don't tell anyone that a child is born to them because of the cleft. So there is a lot of social and psychological problems associated with it, and there is a very poor acceptance of a cleft patient in the society. Often when the children grow, they are teased by their peer groups, they are neglected by their peer groups and friends. Next is they have a feeding problem. The cleft lip or a cleft palate babies are not able to drink or eat the food properly because whatever milk they are fed with, it comes out either through the nose or some of the milk may get into the airway. So there is a risk of aspiration and the feeding is compromised and they are often sick and suffer from chest infections, pneumonia, and due to that they do not get the adequate growth, growth milestones, and they are malnourished, underdeveloped. Also, they have a speech problem because of the cleft palate or the cleft lip. Correct articulation of the words do not happen, so their speech is something which people can't understand unless they are operated and the cleft lip or the palate is repaired. Also, they have a facial asymmetry. The side in which the cleft is there, that side does not grow properly. At times they have hearing problems also, frequent middle ear infections. There is loss of school education. People, when they grow up with cleft, it's difficult for them to find a job because of their speech problems or of the facial appearance. But the good thing is, this problem can be completely treated, and a child who is having a cleft lip or palate, he can become almost perfectly normal and lead a normal life like any of us. So, what are the requirements for the surgery? Let's try to understand. It depends upon the severity of the disease. The child may need from 1 to 5 surgeries over a period of 20 years, depending upon the severity. The first surgery which is performed for the cleft lip is at the age of 3 months, and there is a body weight requirement for it, at least 5 to 6 kgs of the weight the baby should achieve for a safe surgery. Apart from that, the blood investigations report should be normal and the baby should be healthy at that time. Similarly, the next stage of the surgery is the cleft palate surgery, which is usually done at the age of 8 to 9 months when the child weight is around 9 kgs. Again, the other conditions for the surgery remain the same, that normal blood tests reports and a healthy child is required. After these first 2 surgeries, the child will need dental treatments, dental rehabilitations, then alveolar bone grafting is required at the age of 7 to 8 years. Then orthognathic surgery might be required in some children to correct the facial asymmetry and facial deformities. Apart from that, speech therapy is required from the age of 2 to 3 years onwards, so that the child can have a normal or near normal speech. And then finally, some residual deformities of the lip, like scars or the deformity in the nose, is corrected at the age of 15-16 years. That is, rhinoplasty or lip nose revision is done. Then we should now try to understand what will be the cost for such surgeries. Normally these surgeries are expensive. Each surgery costs around 1.5 to 2 lakh. But the good news is, for poor patients who cannot afford this much amount for one surgery, this surgery can be done free of cost at Shanti Mukand Hospital. And this surgery is supported and funded by NGO ABMSS, whose headquarters is at Bangalore. ABMSS is supporting for cleft lip and palate and other facial deformities surgery since 1993 across various locations. Almost 36 hospitals are being funded by ABMSS, and Shanti Mukand Hospital is one of them in northern India and Delhi NCR region, providing this free surgery. The surgery is fully safe, and the infrastructure and the nursing care and the technology available in the hospital is one of the best, so patients don't have to worry. They just need to come to the hospital, get admitted and get this free surgery at Shanti Mukand Hospital. Thank you.